there is no gender bias in their decision making that gets influenced. And 80.8% were of the opinion that clinical treatment or the cure is not relevant or influenced by gender of the treating gynecologist. At last, I would like to say that if females are more for females, what's the issue if they can provide comfort with treatment? Thank you.
So I have a question for both Isha and Muskan. So you've talked about the gender bias and females being more predominant in obstetrics. You also mentioned that the male ratio is very less. Why do you think when you said that females have the comfort of understanding each other and all those things? Do you think a male doctor would not be able to do the same?
No, it's not like that. The male doctor won't be able to do like that. Would not be able to do the same because yes, he might not feel the pain, but anatomy, physiology, a male also studies an MBBS course, so he knows everything about that. So he would actually deliver the best which he feels like.
Okay. Thank you. The next team.
One of my questions is, I'm Ricky from Adrenergix College, and I'm here to talk for the topic that is how addresses gender disparity in OBG and gynecology.
Ricky, your voice is still a little mumbling. It's not very clear.
Am I audible now?
You're audible, but your voice is not clear.
Just a second.
Noise in the background, Ricky.
Better now, ma'am?
Yeah, much better.
Can I start my
Yeah, we can
debate,
start.
ma'am? Okay. So, good evening, one and all present here. I'm here to talk for the topic that this house addresses gender disparity in OBG and gynecology. First of all, this topic is of major concern because 84.2% of applicants for MD, OBG, and gynecology are females. That is basically the male ratio is super less. We need, and the clinical training also states that there is an inequality when it comes to training male patients. We have all seen Dr. G movie in Hindi, which clearly depicts this. And also, we are the ones who assume that female patients are more comfortable with females, but that is not the case. A study by the University of Newcastle has said that over 94% of the population doesn't care or worry about the gender of the doctor. All they want is proper treatment from an efficient doctor. Thirdly, the Allahabad High Court has said that when a petition was raised by Dr. Alok Kumar Singh telling that government seats for MD residents is being allotted more for females, the court actually said that men can also practice OBG and gynecology efficiently, equal to female. So there should be no disparity or reservations for women. And also, ma'am, there's also this specialty called andrology. But then there are leading female andrologists who practice, but we never.
Rishi, I'm sorry to interrupt. Can you come to conclusion part? The time has got over.
Yes, just a second. Okay, but why does it come only when we talk about gynecology and OBG? And also, there should be for proper research in this field. Studies show that inputs from varied sex and transgender should be there. For that, I think this disparity should be ended. Thank you.
Okay, Rithi, who's your partner?
Graduate, almost 82.6% were female. Colombia, OBG hardened who sexually assaulted patients for more than 20 years. Basically, a female gynae can understand. That is, there is no meaning of highly professional and expensive male. working in women's healthcare today. However, many women prefer to see a female gynec when it comes to their well-being and care because they feel that a woman can understand, another woman can make feel as ease and safe. Women often say that female comfortable to a sex and reproductive health with another woman. A female gynec know how a woman's body feel. Patients say that they feel especially anxious about talking about pelvic pain, discharge, etc. to a male gynec. That matters because feeling comfortable and secure is a key of opening up about symptoms in order to reach helpful like women comes to health. So a no doctor need to address the gender disparity among doctor in OBG. Thank you.
Okay, for Ritti and Priyadarshini. So you have mentioned about andrologists being females as well.
Yes.
So that is the vice versa of this, right?
Yes, ma'am.
So obstetrician being a male and andrologist being a female. Do you think at that situation the male patient has hesitation over the female doctor?
Ma'am, I strongly believe like there are laws in India which states that female nurse should be present when a male gynecologist is examining a female, ma'am. But there's no law stating that a male nurse should be present with a male patient when a female doctor andrologist is doing. So why do we take that only women can be assaulted and not men? I think all doctors are professional. Just because there are a few rare cases of assault doesn't make all doctors negative. So if we as doctors don't respect our own professional mates, then I don't think there's a point. I think we should feel safe in all gender doctors treating us.
Good.
Thank you, Katie and
Next,
Priyadarshini.
Next team. Who's the next one?
Ananya, can you please start your speech? Shweta, are you here with your teammates?
Yes, I'm here.
Okay. The third team, right?
Yeah.
Yeah, start quickly.
So I'm Shweta, studying student from Texas Dental College. So if you want to address the topic,
Your voice is breaking. We can't hear you.
one minute.
Still, it is very. Still, it's very disordered.
1 minute. Come now.
Yeah, better.
And Shweta, studying student from National Dental College. So I'm here to discuss the topic today. So, looking at gender discrimination is basically gender inequality in the field of obstetrics and gynecology. This gender discrimination is only prevailing.
Because after the years also, that after the years, this is more male gynecology business. The reason is that after the society between the serious health and the balance between work and life. We all know it is a 24/7 where a female participation over the years changed more specifically to tell when the society evolved. We have the female participation. That is something to appreciate, but on the other hand, male gynecology started reducing. So it is not the gender disparity vanished over the years, it is still prevailing, but now it is over the male. The reason what I think is that from the patient's perspective, I feel a very specific and education is dedicated to the skill of the gender. Equality is specifically the parents are not gender. They need to know that a step doesn't know what gender bias is, a sculptor doesn't know what the gender bias is. It's only even the medical doesn't know what the gender bias is. It is only Monday who know how that bias is. So patients among the participants of male, those that increases over the years, male taking gynecology as a treatment also only because of this, they are deprived from their opportunities because no they are interested in this. So I would like to tell that when feeling is universal, feeling is universal. There should be an opportunity for those who receive the opportunity has to be given to both. Patients has to treat them as doctor and not male or thank you.
Shweta, who's your partner?
Absolutely.
She can start.
Good evening, ma'am.
Yeah, good evening. Please on your video.
Yes.
Yeah.
Good evening, ma'am. Can you hear me, ma'am?
Yeah, you can start.
Okay. Good evening, everyone, and good evening to the judge. Myself, Saksireka, studying third year on dental education. I'm hailing from Radha's Dental College. I'm here to talk against the topic this gender disparity in gynecology and obstetrics. As a young Bandik dentist, I believe that medicines can cure diseases, but only the doctors can cure patients. As we live in an Indian society, the patients are more concerned and sensitive to address their problems to a doctor in the field of reproductive system or whatever we. So, as doctors, when the doctor and a patient belongs to the same gender, his or he could elaborate his problems very effectively to the doctor, and by the way, the doctor could treat more effectively a patient. As we doctors, we shouldn't be talking on the topic of gender disparity because I don't believe in that. Because the prime concern in the field of medicine is to treat the patient effectively rather than equality, like let it be feminism or the male dominance, whatever. We talk, it can be argued and never in medicine. I believe in that because letting in the field of ourselves in the dentistry or the medicine and various departments is to treat the patient effectively than arguing on this topic. I don't believe in arguing in this. And there have many researches have also been done by the American associations and various Russian countries also that in the field of gynecology, a patient is more comfortable and with a female doctor. A female patient is more comfortable with a female doctor to talk about her problems and to treat it better. Why we need to talk about the inequality here? Because it is just a doctor and patient relationship. We could also say that a doctor will be at his or her position and he will treat the patient effectively. When you could treat them effectively,
Sorry to interrupt you. Can you please come to your conclusion point?
Yes, ma'am. I could so a relationship. We could say that a doctor and patient, he or she must treat the patient. That is only the concern. But the relation should be very better, and the communication should be good between patient and doctor when it comes to the gynecology part. So I would prefer that when I could conclude that rather than arguing on this topic, we could go as for the patient's comfort.
Ma'am, can you unmute the
Sorry, yeah. Shweta and Sasireka. So,
Yes, ma'am.
You mentioned that earlier days we had a lot of male doctors who were doing gynecology practice, and slowly it has declined. So, at a conservative period itself, we had male gynecologists treating women. But at such a modern era, we are facing difficulty convincing a female patient to see a male gynecologist. So, what has changed, you feel?
I feel that over the years, they started like the reason why over saying that it is a feeling, but not so why the males have reduced is because of the patient preference. The main reason I feel is that patient preference. So only thing to distract this is that patients has the society has to be given awareness that doctors are it could be male or a female. Every doctor is a talented professional. Both a male doctor and a female doctor have studied the same course. They are able to treat a patient effectively. I think that patients can choose their doctor. They have the right, but they can choose based on their experience. But choosing their doctor based on gender, I feel it would be meaningless. Thank you.
The next team?
Yes, ma'am. Am I audible? Should I turn on the camera?
Yeah.
Am I visible?
Yes.
Okay. Shall I start?
You can start.
Good evening to the respected panel of the jury. My name is Vijay Shankar Murugan, a fresher from Trichy SRM Medical College. I'm here to speak for the affirmative side of the debate, addressing the critical issue of gender disparity in obstetrics and gynecology. It is my firm belief that individuals of all gender should have the opportunity to contribute to this vital medical field. So, it is my firm belief that they should contribute to this medical specialty because of two key points. Firstly, equal opportunity and merit-based selections. Some argue that gender-based disparity is it's not solely due to discrimination, but rather reflects on individual choices. And while this may not be true to some extent, we must also acknowledge the social stereotypes and biases that can influence these choices. Women should have the freedom to choose their own medical specialty based on their interests and ability, but only mainly due to their merit rather than being steered into specific fields because of their preconceived notions. Merit-based selections should be universal and should not have any preference to any gender or race. Secondly, diverse perspectives. In obstetrics and gynecology, patient care involves deeply personal and intimate aspects of a person's life. A team of healthcare professionals from various genders and races can bring a broader range of perspectives, empathy, and understanding to the table, ultimately improving the quality of patient care. In conclusion, it is imperative that we address gender disparity in obstetrics and gynecology to ensure equal opportunities for all individuals, regardless of their gender. By doing so, we not only promote fairness, but also we enhance the quality of healthcare in this medical field. Thank you for your attention.
Jay Shankar, your teammate is?
Amna.
Hello, ma'am.
Yeah. Please start.
Yes, ma'am. Am I visible and
Yeah.
Good evening to the respected panel of jury. I'm Amna Maroof, a fresher at Shakespeare Medical College. Today, I'm here to discuss the pressing issue of gender disparity in obstetrics and gynecology field.
a field focused on women's health. This disparity, although surprising given the field's nature, is evident. It's crucial that we address it to achieve greater gender equality in this field. Firstly, access to care. Some patients prefer discussing sensitive issues with female healthcare providers, denying women the opportunity. Hello? Denying women the opportunity to become gynecologists limits access to this care and patients' right to choose their healthcare provider. Secondly, cultural and religious sensitivity. Female gynecologists can better accommodate cultural and religious sensitivities, respecting patients' beliefs and values in healthcare. And lastly, choice and patient autonomy. Providing women with the choice of a female gynecologist respects their autonomy and aligns with patient centered care principles. Gender disparity in obstetrics and gynecology is not just a professional issue, it's a matter of equality and human rights. Denying women opportunities based on their gender is discriminatory and unjust. It goes against the principle of equal opportunity and non discrimination that we uphold in the society. In conclusion, addressing gender disparity in obstetrics and gynae is essential for women's healthcare, challenges stereotypes, and promotes equality. It's our collective responsibility to create a more inclusive and diverse field that benefits both healthcare providers and patients. Thank you.
Okay, for Vijay Shankar and Amna. So you had mentioned that denying female her rights is discrimination. For example, she is located at a remote village in a peripheral PHC or CHC where there are only very limited medical access, and there is only one medical officer who is a male, but he is very much trained in gynecology, and he takes care of the women of the whole village. And there's one particular woman who's saying, I don't want to be treated by him. What will you do at that situation?
First, ensure that the woman has what do you say, a minimum level of comfortability to address to the doctor first of all, and secondly, it's her choice whether she wants to get examined or not. We have to respect her choices, and thirdly, for her sake, we should actually try to compel her into getting a checkup because this doctor is a trustworthy source. He's very skilled, and what we can say is that even we can say that even at times of really needy times, we can sort to anything. We can sort to anything needy times.
Good.
Thank you. Should we stay in this meeting?
Yeah, please stay, but let the next team talk. Who's the next person?
Sridevi and Snega, are you here?
If they're not there, we can move to the next person.
Guys, you can. Team 6, we're here actually.
Okay, introduce yourselves.
So, this is Roshan here. I'm doing my final year MBBS at Coimbatore Medical College.
Can Roshan start?
So, I will be speaking against the motion, ma'am.
One second. I'm just checking if your timer is on. Tamil Arasi was doing the timer.
Yes, ma'am, I'm seeing the time.
Okay. Start, Roshan.
Greetings to everyone here. So I'm going to speak against the motion of gender disparity in obstetrics and gynecology. So as parents, everyone would want their child to do what they want, and only when they start to do what they want, they become successful at it, and the best outcome is arrived only when they do what they love to do. And here, as doctors, we will be having so many wishes in our lives, and one of the wish for a male individual could be an obstetrics and gynecology. And the social stigma that's associated with male individuals, the gender disparity in OG should not be preventing them from taking it. And what is the main conflict here? Whether the patient has a preference towards a male or a female individual. Yes, if they have a binary option of preferring, they might have. But generally, over 50% or even rather more than 75% of the individuals don't even have a preference at all. Then why do you prevent your ward from doing what they want or what they like? The physician's competence is not actually gender dependent. So as I spoke from the doctor's point of view, now I'm deviating to the patient's point of view. The outcome of the patient, whether the patient has a good outcome or not, is actually not gender dependent at all. We have a good outcome, whether be it a male individual or a female individual, pursuing obstetrics and gynecology. And encouraging more and more male obstetricians would actually prevent something that's happening in the rural setup, which is various deliveries being conducted by guys and untrained professionals are being done because there is lack of manpower there. And if we encourage more and more male individuals in pursuing what they love, then that wouldn't be a problem. So here I am putting forth a few points, just a few points due to my time constraints, that from the doctor's point of view, why they should be pursuing, because they should love what they do. And from the patient's point of view, the outcome of the individual, how the outcome is one and the same with the male and female individuals. And yes, the competence of the physician is actually not gender dependent. And in rural setups, for a country like India, we should be encouraging more male individuals. Thank you.
Good evening, everyone. I am Sarath Chandra, a final year medical student from Great Eastern Medical School and Hospitals, Srikakulam. I am supporting this motion of gender disparity because in this, women are more comfortable with womenosis than men. So I think there is no requirement of these male OGs in this. And again, the thing is, women are well represented. They are represented well in this department. So I think there is no point of thinking about men. And according to some many researchers, it's like transgender men. They are free with female OGs than with male, even though they are transgendered from male to a female. They are more comfortable with the female OGs. And in another research, there is another research stating that women obstetricians are showing better performance in surgeries than men obstetricians. So according to these studies and according to the patient's views, and again these women OGs, it's like they can feel what the other woman, the opposite patient, what they are feeling, what they are going through, whatever maybe, they can feel that. So I support women. It's like I am supporting this motion. Thank you.
Okay. Roshan and Sarit Chandra. So you both are in final year, so you're exposed more to OG also. So if given a chance, would you prefer being a gynecologist?
Yes.
Yes, ma'am.
Yes. Why?
To be very honest, the subject of OG personally interests me. Not just OG as well as surgery. And from a personal experience, I was just talking to my batchmates about this. Won't be supporting my stance on my whatever I spoke before. So I was just talking to my batchmates whether they'll be preferring a male obstetrician. 3 to 5 of my batchmates told straight away no, and a couple of my batchmates even told that they won't be marrying a male obstetrician. So I was like, okay, I should probably not take OG, I should go with surgery itself. So, but I wanted to speak against the motion specifically for that.
Okay. So, but both of you are agreeing to be gynecologists because the subject interests you. So that is more important. So eventually you will be trained into good gynecology because for the passion of the subject.
Yes.
Okay. Next team.
Thank you, ma'am.
Thank you, Roshali.
Thank you.
Who's the next speaker? I'm waiting for the next person.
Hello. I'm I'm sorry. Good evening, ma'am. It appears that Team 7 is not here. So me and my me and my friend, we are Team 8. So we'll be starting. So
Yeah,
just to
go
say that
ahead.
this is Team 8, and we have Ananya Sharma and Varshini. I'm speaking for the motion, and Varshini will be speaking against the motion.
All right.
Okay. Varshini. So, ma'am, I'll be starting in 3, 2, 1, go. So, if you type on Google, "are male gynos," the top search result is weird. Then it's creepy. Then it's exist. Oh, do they even exist? Sadly, this is the problem in our society. Major part of our society believes that women should be treated by a women physician. These beliefs stem from the prejudice that a female would better understand a female problem. So if that's the case, I asked the house that maybe we should let children be pediatricians, for children might be able to better understand the kids' issue. Because inherently, that's the argument that opposition raises tonight. In contrast to popular belief that women gynecologists provide a superior patient care, a study by Stanford shows that female gynecologists are 47 times more likely to get a less than satisfactory result than their male counterparts. Also, another study by John Hopkins shows that male gynecologists express more care and partnership than their female counterparts. This might be attributed to the fact that men have heightened sensitivity about the distress that gynae exam can cause because they themselves have never undergone one. Also, the amount of pressure that a male gynecologist feels to secure a patient and then to maintain that patient for a second visit is immense on a male gynecologist because male gynecologist faces more pressure to maintain their standing in a professional front. Also, this gender disparity does not just exist from the patient's perspective, but also from the doctor's front, which wasn't mentioned by my speakers before. For example, female medical students are more likely to take up gynae branches, peds branches, branches like microbiology over branches like neurosurgery, orthopedics, general surgery, because major part of the medical fraternity itself believes that gynae is an easier branch and a better fit for women. Despite the fact that my debate just shows that there's sufficient literature which suggests that it's not gender rather than character of physician, empathy, the
Ananya?
personal style that takes preference.
Ananya, come to your conclusion, Ananya.
So, just to conclude, ma'am, I would like to say that let's stop. Listen to women. If we become empathetic enough, maybe gynecology would finally be a genderless branch. And this would have to start by addressing the gender disparity that exists. Because only by acknowledging that a problem exists, can we be better able to solve it. Thank you so much.
Okay, your partner?
Am I audible?
Yeah.
Can I start?
Yeah, please start.
Respected judges and my dear peers, good evening one and all. Myself Varshini, a first year MBBS graduate from MNCRI, is here standing in front of you all presenting my views against divorce. Let me start with some statistics. Considering 45 million women who's below the poverty line in India, a pregnant woman who's from that society who is backward both economically and educationally would of course prefer a female doctor over a male because she feels more comfortable with a female. Isn't this a typical Indian woman's mentality? Surveys show that most women feel embarrassed talking about female-specific issue even with a health practitioner. I would like to share my personal experience of speaking to a teenager who faced PCOD. She acknowledged that she felt awkward. I would like to clarify that it's not an assault, but she felt awkward during an examination by a male doctor. I can strongly say that no woman would be convenient in performing transvaginal tests or anoscopy by a male doctor. Me, myself, not being feminist, But a man would certainly not understand how severe menstrual pain or a labor pain would feel like, because he's never gonna experience it ever in his lifetime, right? I would like to conclude by acknowledging a famous Tamil saying which says, "ஒரு பொண்ணு மனசு ஒரு பொண்ணுக்கு தான் புரியும்," which means only a girl can understand other girl's feeling. Thank you.
Okay, Ananya and Varshini. So you had mentioned that if male doctors are more empathetic, then they might end up at gynecology as well.
Good morning, good evening, ma'am. Ma'am, what we as a team or what we in the foresight believe is that gynecology or any branch in medicine should be genderless. For a person to be a good doctor, you should be empathetic, you should be skillful, and you should have better patient communication. If you can have better patient communication, even if the patient feels apprehensive about a transvaginal examination, then you as a doctor should be better able to communicate what are the reasons we are doing this. The patient in front of you would feel comfortable to see you as a doctor. So you should be a doctor first, then a male or female. That's what we want to say, that gender disparity exists because of the social constraints that people have in their minds. But that shouldn't be the case. Both the doctor as well as the patient should believe that gynecology or any branch in medicine should be genderless, and that's what we are arguing for.
So Varshini had mentioned that she was examined by a male doctor and she was not comfortable. Not you, a teenager. So at teenage, they're not really susceptible to examinations every now and then. They're like new timers to this, right? So when it is a male doctor, do you feel what Ananya has told is...
I'm not talking about the trust issues which they have on a doctor. I'm saying that their privacy matters. Typically, she considers privacy as something very big to her. No, it means something really big to her.
No, what Ananya mentioned is you need to communicate. So if that person had been communicated earlier, would she have been more comfortable?
Yes, ma'am, but still, what we're trying to say is that a typical Indian woman would always put her privacy as her top priority. She always does that. According to statistics and surveys of Indian association would always say that typical Indian woman always does that. She always considers her privacy to be the top priority.
So if you, if in that case, there is a male doctor and try to come to a point where they make the patient comfortable, would it be possible to still take out anxiety of the patient?
I don't think so.
Okay.
Hey, ma'am, here, ma'am, I think that the doctor is better in their communication skills, is better at building trust and rapport with the patient, is skillful in their job, then each doctor, no matter their gender, would be able to better serve the patient. And that's what we are here for. We are here to serve the patient. So your gender shouldn't be discriminated towards the fact that you're a male gynecologist. So I think the patient would feel comfortable if you are better at communication.
Okay.
Thank you, ma'am.
Okay, good. Thank you. The next team.
Good evening, ma'am. Am I audible?
Yes.
Ma'am, this is Manishankar from Coimbatore Medical College. I'm doing my final year, and I've got my friend alongside, Elil, who is my batchmate as well. We are both in the final year.
Okay.
So I'll be speaking for the motion, ma'am. I'll be supporting the point of addressing equality, and he'll be speaking against the motion.
Your good name again?
Manishankar, ma'am.
Okay. Yeah. You can start.
Can I start, ma'am?
Yeah, you can start.
Okay, ma'am, good evening to everyone. I'm here to support the gender disparity that is actually present in obstetric and gynecology. As statistics say, more than 80% of them are female obstetricians, and this has come out as a result of a beautifully scripted stereotype. So if you ask me as to why the female prefer more of female, we got a lot of varied opinions. First thing that many people put forward is because of the point of empathy. They say a female will be able to be more empathetic. That's not the point at all. Out of my personal experience, I have inquired a lot of my female friends who have been into labor postings, and what they have been able to tell me is that they were really petrified by the agonizing pain that the women went through, and they wanted to have an LFCS done or a prenatal block done. Whereas on the other hand, when I went on to inquire into asked one of my male partner, they were like more empathetic and they were like able to develop more of respect towards the kind of pain their mother had actually gone through, and that has really sensitized them a lot. Also, male will be able to know the qualitative amount of pain that the female goes through. Certain amount of pain will be just normal for another female counterpart, but that it's not so for men. A man's ideology, he'll be there in a position to find a solution for a female's pain and he'll be trying to mitigate it. Another point that we come to is that of religion. Many people say that religions don't permit females to be examined by a male doctor, but for us, every patient, being a medico or a medical graduate, all patients are sacrosanct for us. Religions even don't permit the use of animal-based products for the treatment of their followers, but that doesn't come into the picture of medical practice because I don't think God would be on the way of saving a patient on the basis of religion rather than saving the life of a person. Also, we as Indians live in a patriarchal society. Male chauvinism is quite dominant among our society, and one main reason for this is the lack of sex education and lack of awareness of the pain, physiological day-to-day problems that the females face. If male are more empathized and sensitized towards the day-to-day problems,
time is over.
Yeah. Final point. I'm coming to the conclusion. I would like to say that Dennis Mukwege, who is a Nobel laureate and he's a world-renowned gynecologist who is helping out the victims of sexual violence, is actually a male. Thank you so much to the forum for an opportunity. Thank you.
Okay. Your partner?
Yes, ma'am. Good evening. Yeah. Am I audible, ma'am? And
yeah,
am I visible, ma'am?
Yes.
Shall I start, ma'am?
Yeah, please start.
Yeah. Now, I am going to talk about that female gynecologists are more better, ma'am. The case is everybody previous more patients than doctors in our society. So what patients thinking is they are more opening up to a female gynecologist. Females are opening up to a female. So we have to give them an opportunity to become more open and so that they can tell their problems easily to the gynecologist, female gynecologist rather than a male gynecologist because they feel more comfortable. We are not a developed country like US or UK or whatever. As a developing country, this is the present situation and we have to accept the situation and we have to take remedial measures to make this whatever future plans we have. But what we are having in our society currently is there is a gender disparity and most of the female patients don't prefer a male gynecologist and that's the reason we can't find a male gynecologist in our country more commonly than a male gynecologist. So I would like to conclude my speech in that female gynecologists are best for female patients. I thought of speaking more content, but previous covered my content, so I don't want to repeat and bore the judges. So I like to conclude my speech. Thank you, ma'am.
So Mani Shankar and El.
Yes, please.
So what Mani Shankar has said is at certain pain is different from one female to another as well. That's what he mentioned.
No, I was trying to mention the fact that, for example, I have actually gone through this personal experience where, like, one of my friends was in severe menstrual pain. She gets severe menstrual pain usually, and when I asked her, like, she's from Haslaki, I asked her, why don't you go and seek help from one of your counterparts? She was like, no, they turn a cold shoulder and they say, oh, all of us go through this pain once every week. But as men, when we see some female being in pain, our intent or our conscience asks us to help the patient. So we are more empathetic and we are more sensitized and we are able to qualitatively assess the pain of the patient. When it comes to the other female counterpart, for the female counterpart, everything is the same, but we are able to more extrapolate things. If it is a pain, we are able to like, okay, in what ways can we help? That's the kind of intent that we put forward.
Okay. So here, more than the gender, you're seeing more as a doctor.
Obviously, yes, ma'am. Because having more on the whiteboard, I think we should have all forgotten our gender before we have got into the profession. Coming to the point of culture being a disparity here, I think culture is or religion or tradition, anything for that matter, is just like goggles. If it's gonna obstruct the vision of like helping someone out, it should be just removed and kept aside. We should prioritize things. Priority comes to like mitigating pain and relieving a person of pain rather than bringing in all these things which are immaterial actually, which is gonna have no much role in saving the life of patients.
Then Eril, you had mentioned that there are more commonly only women gynecologists. But who are the more successful ones?
Ma'am, successful in means of what? May I know this?
In means of giving comfort to the patient, empathetic.
Ma'am, in means of giving comfort in the sense women are more comfortable with women, it's obvious. We don't need to address it actually, ma'am. Even me being a male, I can't address. Even I got a sebaceous cyst in my axillary region. I found it difficult to tell to my any female friends, ma'am. That empathy should be there to the female also. That's what I think, ma'am. How
That is
can they
more
go on?
But Mani Shankar disagrees to that.
That is more of a
Ma'am,
subjective
yes, ma'am.
feeling actually,
Yeah, no,
because
actually-
okay, once upon a time there was this fact that women are there to be confined to the kitchen as such, but when we see the most successful chefs in the world, actually the more men actually top list. Similarly, when it comes to peacocks, we've got a more female peacock, but the male peacock is the one that's able to actually have a beautiful visage. So that's it. It changes over time. My colleagues spoke about the fact that we are not a developed nation as such. We are developed. Yeah, obviously, yes. When we are to progress into a developed nation, you have to change your perspective of thinking. You have to get your population more aware about the problems that each one of us are facing. Actually, each of the sexes are facing a lot of problems. We have to be made aware of that. Only we then will be able to get into the path of development. Is what I feel.
Ma'am, and I would also like to add one point, ma'am. What Mani Shankar said about that menstrual pain, ma'am. Now, female know the pain more than a male, ma'am. So I personally think that they might have an intention of distracting that person who is in pain to just forget the pain, and that may relieve. It may give some psychological relief, I think, ma'am.
Exactly. That comes to quantifying the pain. We are able to quantify the pain, but we are able to qualitate the pain. Pain is not to be like they are able to qualitatively assess the pain, but we are able to feel the pain that's going through. They are in agony. We would like to help them. That's the question.
There's a difference in feeling pain and in the pain. That's what my point is.
I think this might be going on and you will be debating with each other. Okay,
actually, both are benchmates, ma'am. So we both speak a lot.
Okay, it's a very nice perspective to hear about. So it's good that your bench you have different. Thank you so much. Yeah. Yeah.
Hi, Pooja. Start now.
Good evening, everyone. I am Pooja Sadhu. We are first year medical students from Government College, and I'll be talking for the motion and he'll be talking against. So here are the reasons why I believe gender disparity in obstetrics and gynecology should be addressed. A doctor is a doctor regardless of gender, and both the genders have equal rights to choose a specialization that they wish to pursue. Yet the number of male gynecologists is on the decline, and it has been rapidly decreasing. So gender biases within medical education systems can give way to gender-exclusive training environments that may further discourage male medical students from considering the career, resulting in the loss of gender-diverse perspectives. And despite perceived gender biases, male medical students reported increased OBGYN interest post-internship. They were interested, and yet, unfortunately, their interest did not translate into residency applications. In a study where 234 OBGYN patients were surveyed, more than 56.5% chose a man for their care, and patients also prioritized the physician's care attributes like technical skills, compassion, and experience over gender when choosing OBGYNs. Also, male medical students more commonly reported exclusion from clinical opportunities, although objective clinical exposure was like that of female counterparts. Not only were male denied opportunities, the gender also seemed to negatively impact their internship experience, and many felt by OBG residents because of their gender itself. So recently, a movie came out called a Bollywood movie came out called Dr. G, and it's about how an aspiring gynecologist is the only male doctor training in a class full of female students, and it's about the difficulties he faced. And a male gynecologist working as a senior consultant in a hospital in Ahmedabad spoke to ET Times about how fascinating he found the subject.
Pooja, can you please conclude?
Okay, so I was saying that the male gynecologist deeply related to the protagonist of the movie. To conclude, I'd like to conclude by saying that as a woman medical student, I may not have first-hand experience when it comes to the difficulties faced as a male in the OBG field, but I deeply empathize with the disparity that they experience, and I hope that it changes in the future. Thank you.
Pranav, you can start.
Good evening, ma'am. I hope I'm audible. I extend my greetings to the jury, and I'm talking against addressing the issue. So my points would be: a woman living in an ecosystem made for women and surrounded by companions of the same gender would know better about the issues that a woman faces in extending her issues and her complications in front of a male obgyn practitioner. So I think a female obgyn practitioner in that matter would be better. And also the qualities which make a medicinal practitioner the best out of this batch would be competence, rapport building, empathy, and personal comfort. The first three, however, are subjective to each person, but the personal comfort part in this case comes down to a female-female interaction being more comfortable for the female. And also increase in female obgyn practitioners, increase gender concordant care, which is very much feasible for the population, more specifically in the Indian population. And I just want to go with, and I just want to advise that we should go with what works best and not what is wanted by the society. And for women who are cultural and religious, the benefits, if any, of seeing a male doctor do not outweigh the endangerment of her cultural beliefs through any such approachments. And I say that let's leave the choice to the females. If they want to see a male, it's their choice. If they want to see a female, it's their choice. Let's just leave it to democracy is what I'm trying to get to here. And also the points that my colleagues mentioned before me was female gynecologists understands the problem better. And one more point is that sex-specified vulnerabilities are more effectively articulated to a female obgyn practitioner than a male one. And also there are very numerous religious factors and cultural taboos linked to this topic. And these are the points why I support not addressing the issue. Thank you.
Okay, Pooja and Pranav Kumar. So you had talked about that movie where the protagonist is the only gynecologist amongst the women. So do you feel this gender bias could also be because of peer pressure?
Yes, I do believe that it could be because of peer pressure. In a class full of female students and only one male student can be very pressurizing. And as a woman, many of my women colleagues they choose to take up gynecology, and as a man, it has been seen as like a taboo or like a stigma to take up gynecology. And yet the protagonist, out of interest of the subject, out of interest of the science of it, has chosen to be a male gynecologist.
Okay. Pranav, you being a future male doctor, you feel giving the point that only a female can give the comfortable nature to the female. Would you not be able to do the same to a female?
As long as I am competent and I build a good rapport with the patient and I'm empathetic with them and they feel comfortable with me, as long as all these check boxes are ticked, I feel that I'll be very effectively giving them the care that they need.
Okay. Thank you. Next team. Yeah.
Thank you, ma'am.
Thank you, Pooja and Pranav. And Bhavik, are you here? You can start.
Hello, am I audible?
Yes,
Good evening, everyone. I'm Bhavik, and I've got my friend Kavya. I'm third year MBBS, and she's second MBBS. And today we would be talking, I would be talking in support for the notion that is addressal of gender disparity in the Department of Obstetrics and Gynecology, and she would be refusing the addressal of gender disparity, and we'll see how it goes. So I'm Bhavik Anandraj, and once again, and I would like to talk in support for this topic. And what do you mean by disparity? Disparity generally means inequality, or should I be more precise? I could call it injustice. Injustice in any form is not supposed to be there. But in this generation, in this 21st century, we could see a lot of inequalities among people, like gender and everything. But in the field of medicine, the only department or the only field that keeps progressing from year by year, generation by generation, time by time, it's been the field of medicine, be it instruments, or be it the doctors, or be it the civilization, or be it the exams. We've got NEET PG, we've got Next, and so on. That's helping us to test and improvise us and go on, so on and so forth. But here, I think the only department where only women are predominantly there, I think I would call it obstetrics and gynecology department. I don't think that it would be not a great environment, because only women are there, and there wouldn't be much kind of interaction. Because if a man could be there, he could help, he could share his knowledge, and a girl could share her knowledge, and it would be very interactive among them, and that would be more productive. So just like we tell, like women are they do only the cooking job, it shouldn't be that way. Like even men have taken up cooking, and in most of the homes nowadays, it's been the men who started cooking. So likewise, it would be nice if men to take part in doing the obstetric, in joining the obstetrics and gynecology department. And for a doctor, I think gender is not something to be misappropriate or anything. For a doctor, be it a man, women, or a third gender, it's always a life, it's always a patient, and for that matter, at that point of time, it should only be a life that concerns the doctor, and it shouldn't be anything that
Come
disappoints
to
the
the
doctor.
conclusion part.
Okay, I would like to conclude that irrespective of any gender, doctors should be well enough and qualified to practice obstetrics and gynecology. And if she so is well enough equipped and is interested, should definitely take part in doing it, and should be encouraged to further get involved in the department and continue performing surgeries and consultancy. I would like to further decline my speech by telling that men and women should be equal in every sort of thing, and I wish that we have men in the
Thank you, Bhavik. Thank you,
department of
Bhavik.
obstetrics and gynecology. Thank you.
Kavya, can you please start?
Yes, ma'am. Good evening, judges, ladies and gentlemen. I stand before you today to express an opposing viewpoint regarding the issue of addressing gender disparities in OBG department. While gender equality is a fundamental principle we all value, we must also consider the potential unintended consequences of hastily addressing this issue in a way that may not be in the best interest of the medical field as a whole. Firstly, it is essential to recognize that medicine, including OBG, is a highly competitive field. Doctors are promoted and recognized only based on their qualifications, experience, and merit, and not based on their gender. Advocating for gender quotas or preferential treatment could undermine the meritocracy that is crucial for maintaining the highest standards of patient care. Furthermore, addressing gender disparities in OBG might lead to unintended consequences such as reverse discrimination. If we prioritize gender over qualifications, we risk overlooking highly qualified male doctors who have dedicated their lives to this field. Pushing for equal representation at all costs may not align with the individual choices. OBG is a field that involves highly sensitive and intimate patient interactions. Some patients may have strong preferences for the gender of their healthcare provider. In such cases, forcing equal representation might not serve the best interest of the patient. In conclusion, while we all value gender equality, we must be cautious of implementing one-size-fits-all solutions in the OBG department. Thank you, judges, for considering this alternative perspective and your valuable time.
Okay, Bhavik and Kavya. So one size fits all can't be done in OBJ. So Kavya, you're in which year?
I'm second year.
Second year. You're going for your other postings as well, right?
Yes.
So what is the gender that is common among orthopedicians?
Males in our college.
Okay, why so?
Ma'am, I personally feel that they have a strong preference for that department, for that specialty.
Okay. So generally it is said that ortho is a physically taxing field. And they feel that women are not physically meant for orthopedics. That is the common notion. And we feel obstetrics is not for men because they are not compassionate enough. Do you agree with this point?
No, ma'am, I don't agree with this point. We also have male PGs here in the OBG department for compassionate enough. And if it means from the patient point of view, as we live in a rural area here in Salem, they're not so comfortable in visiting if a male doctor. If it means we try to we try to get them into that by explaining them that we also have a staff nurse by the doctor's side, so that a woman is present with you all the time. A female nurse is present with you all the time during the checkup while he's checking up, and even while giving birth, his husband or his partner could accompany.
That's a very good point. So the labor partner can be the husband.
Yes.
Whereas you're neutralizing the gender disparity there itself.
Yes, ma'am.
Yes? Yeah? Okay. Good. Okay. Next thing.
Good evening, ma'am. Am I audible, ma'am?
Yes, you're audible.
Ma'am, myself is Swati and my teammate Yogita is here. I am going to talk in favor about the gender disparity in the field of OB and gynecology among the doctors. Yes, ma'am. I would like to get started with this. So, yeah, ma'am, me being has the death student from the final year, I have experienced lots of problems and lots of issues among the doctors itself. I used to go for medical roundings with my staffs. So I have noticed that there are certain discriminations which is going in between the doctors in the departments. The doctors themselves feel that they are not comfortable working with the patients there. And also the thing that they feel is like they are not confident enough whether they can make the patient comfortable and they can bring the patient into the comfort zone. So yeah, those doctors are the only people that they put themselves into a point of discrimination. So first, doctors needs to come out that they can manage the patients. Yes, I do favor that the discrimination is going among the doctors there in the Department of Gynecology. Thank you, ma'am.
Okay. Your partner?
Good evening, ma'am.
Yeah,
Very
good
good
evening.
evening to everyone. So, yes, Swati, I agree your point. But this topic is something existing now is ironical because we have crossed on this to the modern era. These kind of disparities are still existing because of people's insecurity over this. We have to incorporate and directly address these kind of gender-based discriminations like this OPG into implement bias trainings at the level of medical colleges and residency training programs so as to encourage dialogues among men with gender-based discriminations about the field. And secondly, it all starts with sex assault, as we say, as male touch. So I'm asking a question. It's a common question. Even we go to a cardiologist or even we go to a urologist, they even palpitate us, right? Even if you go to a cardiologist, they palpitate here and there, and they palpitate and sense us and say, okay, you have diagnosed this and that. And even if you go to a urologist, they say they have to view on with whatever infections in the genital area only. Then why are you just seeing that as a difference from this? Even we here, it's the things are like, it's just a subject. When it comes to doctor, we have to see it as a subject. It's not this men or women, it's not genital area or wherever it is. We have to see it as, okay, it's a subject. We as doctors, we are studying whatever, so we have to see like, okay, it's a subject and we have to move on. All this is from people's view. They feel insecure, so we have to teach them that you should not feel insecure. We doctors will diagnose it. So this kind of disparities is starting with only people. So first thing, you have to teach people about this, and then as doctors, we should also come in front and say, yeah, it's not men or women, it's doctor. That's it. Thank you, ma'am.
Okay, Swati and Yogita. So Swati has told that the gender disparity starts from the doctors themselves. So they are not confident and they are not, able to approach the patients. What would be your advice to those doctors?
Ma'am, those kind of doctors, I'm sorry if that might have hurted you, ma'am. But yes, not all the doctors are same. There are some doctors who are not, their maybe their training can be improved, or the teaching from that kind of institutes can be improved, so that the doctors will be bold enough to meet the patients. At last, we being as the doctors, the patient's lives, ma'am. So this kind of motivational speech or the empathy that we are giving or showing towards the patient would help the doctors, ma'am. So doctors, yes, ma'am, they would save the people. I think we can give them the better teaching and acknowledge them with certain skills, ma'am, that can help the patients.
So that is only for the male gynecologists or both male and female?
Yes, ma'am, the male part, some male, yeah, ma'am, they won't be comfortable to go examine the female patients, ma'am. So at that point of time, it is very important for us to educate male doctors, so that they would be bold and confident enough to meet the patients, the female patients, ma'am. Since the gynecology is only about the women, we should treat them, make them happy, and send back them happy with the confidence that we have inside us.
And Yogita had mentioned that if you go to a urologist or a cardiologist, the vice versa happens. So, would you be comfortable being examined by a cardiologist? You yourself as a patient?
Yes, ma'am. I would prefer a female patient because it's my own,
No, I meant Yogita being a cardiologist.
Yes, ma'am. So it is my own opinion.
Because as a doctor, when I wear a white coat, when I hold a stethoscope, I don't see them as a man or a woman, them as a subject, as a patient. So I have to treat them. I don't see which part I'm going to palpitate or which part I'm going to pass. It's just I have to treat them and I have to give the very best treatment to them. That only going to exist. So we shouldn't say that. I don't say that this all starts with people. Even it starts with us. We have to come in front. So it's the communication, whatever said before by the colleagues, because they said that communication is the one thing which we have to be step on to. So it all starts with us, and we shouldn't blame the patients as well.
Yes, ma'am. And also, sorry to the interruption, ma'am. At last, we being as the doctors should always think about the patients also, ma'am. So yeah, I think we end up saving patients. So we should help them, ma'am. Instead of having discrimination between among ourselves, we being as a doctors, it is at last we finally make a team and come out to support a patient. So this is how it works, ma'am. So all this kind of discriminations should be stopped. Yes.
Okay, good. Okay.
Thank you, ma'am.
Next team. We are not able to hear you.
Am I audible, ma'am?
Yes, yes.
I think my
I can hear
co-speaker is
you.
having some mic issues.
Okay.
Hari,
Hari, can you correct please?
yes, ma'am. Am I audible, ma'am?
Yeah, we can hear you. Yeah.
Hello, am I audible, ma'am?
Yes, yes, yes. Who is starting?
Yes, sir.
Okay, please begin.
Good evening, all. I am Yunus Kumar and my co-speaker Hari. I am here to support gender disparity in obstetrics and gynecology. For better clarity, first we need to know about obstetrics and gynecology. Obstetrics is a medical specialty that deals with pregnancy, childbirth, and the postpartum period, while gynecology is a medical specialty that focuses on female reproductive system and women's health in general. My first and foremost support is, even though men are as good as female women in obstetrics and gynecology, female patients are comfortable with their respective gender doctors. Why? Patients prefer female doctors because of some religious and cultural beliefs condemn having a male gynecologist. And some female patients feel awkward and freak out while conveying their problems to male gynecologists. Well, from medical students' point of view, in case of choosing specialty, assuming obstetrics and gynecology has been female-dominated field, male students prefer fields other than obstetrics and gynecology, creating a gender imbalance, which is good as female doctors may understand the problem both as doctor and a female's point of view. From parents' point of view, if their teen doctor having gynecological problems, or from husband point of view, his wife having obstetric problems, they would prefer female doctors unarguably. As female dominating in this specialty is not at all concerned because it makes patients more attached to them compared to male obstetricians, which will help them in diagnosis and treatment planning programs. So yes, I am Hari Krishnan. So I am here against the topic gender disparity in obstetrics and gynecology. Historically, the obstetrics and gynecology practice was dominated by men, but today there is an intensified shift towards more women entering the field. According to the Association of American Medical Colleges 2015 report, women make up to 85% of the residents in obstetrics and gynecology. So why? The scope of being a male obstetrician and gynecology has declined because of patients preferring female doctors as a safer house for their concerns. This is the point where the gender disparity begins, as this leads to male dominating other fields, leaving females restricted to obstetrics and gynecology. So, even though males cannot physically perceive a woman's pain, it does not mean they are desensitized to it. Being a male gynecology has become a rare read. Male gynecology has seemed to have a high-end sensitivity towards the patient. So, all females are not meant to be obstetrician gynecologists, and all men are not meant to be a surgeon or a specialty in other fields. We have all men opting for obstetrics and gynecology, and females opting for other specialties such as surgery. This will be increased by creating awareness and education program about gender equality in medical schools and residency programs for both students and general population. A doctor is a doctor. He or she is not a male or a female. He or she never judges any of their patient. Their sole purpose is to treat them. All they see is the disease and its treatment, not the mask which covers them. So this is my point, ma'am.
Okay. Yogesh and Hari Krishna. So to both of you,
yes, ma'am.
Which year are you in?
We are having study second year PDS.
Okay. Okay. So BDS. So for example, you go to a clinic and there is a female orthopedician. Okay. Would you prefer taking her consultation or not?
Definitely yes.
Yogesh?
Yes, ma'am. Definitely.
Okay. So you feel that your pain and your discomfort is equally understood by a female?
Obviously, yes. Where this is the place where the skill and the experience comes into the place, ma'am. A male can be comfortable to us, but a skill and the experience will not be replaced by anything. So the gender becomes nullified in this area.
Okay. So the same situation, if there is a female male gynecologist, he will also be aware of the pain and suffering of the woman undergoing the labor ward?
He may not actually perceive their problem, but can understand their pain and problems and can able to equal them. Not only females can understand their problem. They can't. The point is the males just can't experience it, but they can understand the problem.
Okay. Good. Yeah.
Thank you,
Good evening, ma'am. Am I audible, ma'am?
Yes, you're audible.
Hello, ma'am. Good evening.
Good evening.
Ma'am, this is Swaminam, and I'm here to talk. I'm here to talk supporting gender disparity, and my co-speaker Sivas is against the gender disparity in obstetrics. Let me start, ma'am.
Please go ahead. Yeah, please go ahead.
Yeah, good evening. Good evening to the jury and FNO organizer. So I'm here to talk about, I'm Swaminam, and I'm the spinal here. I'm here to talk about mainly about supporting point is for gender disparity. So first, I want to start my conversation with the three aspects, from according to the doctors, patients, and from the students. So first, doctors. Doctors mainly, I won't say the females are more empathetic than males, and I don't say any disequality. But one thing I know strong is females undergoes the same physiological process like menses and pregnancy in their normal life stages. So they can more precisely understand the pain and sufferings with the same complex with female case. So that is the main point why female dominance in the OBC. According to the patient, this is matters more other than anything. According to the female patient's document, the patient usually feel more comfortable and they feel more open-minded with a female patients, more open-minded with a female practitioner, and they will speak without any flaws with the female obstetrician or female practitioner. So in the UG students, I used to say the female during study time, the female students are getting more interested in OBC due to the basics concepts like menstruation and pregnancy. They are more used to heard of it. So I think so they at least the basics itself they get more strong. So according to me, it's more we should think practically, because in developing country like India, we should think practically. Still in rural areas and semi-urban areas, most of the females will prefer only a female practitioner. And most of the will only female. Ma'am, 1 minute, sorry. Hello, sorry, ma'am. Ma'am, I'm so sorry. Hello, ma'am, am I audible, ma'am?
Yes, it's audible.
I'm so sorry for the inconvenience. So yes, according to practically, we should think in rural and semi-urban areas. For example, if you are going to take any pap smear survey or screening, females further to collect a pap smear, they won't usually allow, most of the females won't allow a male practitioner to take the pap smear. So these are some of the practical difficulties. So I don't say only females will dominate, but females will dominate till when there is no awareness in the individual levels, and no, there is when the individual level, the individual will think that speaking about their own menstrual problems and gynecological problems is not a taboo. They should think that and they should speak out loudly without any hesitancy. So till that happens, only female will dominate the OBG department. And that's my conclusion. Thank you. Over to speak.
Ma'am, ma'am, I'm audible, ma'am. Hello, ma'am, I'm audible, ma'am. Hello, audible. Hello, ma'am, I'm audible, ma'am. Hello, ma'am, I'm audible. Ma'am, am I audible, ma'am?
Guys, can you make sure fast?
Sir, I'm audible.
Yeah, go ahead.
I'm Subhash. I'm going to talk about the. I'm not going to say first. As the changing demographic representation of both men and women in the field makes balanced workforce. Focusing in competence rather than gender makes recognition of various skills. Increasing mentorship and support and helps in promotion to include various gender. And patients have autonomy to choose their healthcare provider. The therapeutic relationship between the woman and her gynecologist can be replete with regardless of gynecologist gender. Most patients do not have a gender bias and do not believe that gender can impact the quality of healthcare. Rather than gender preference, patients consider factors like knowledge, personal experience, and reputation. A study revealed by the Journal of American Osteopathic Association found that most choosing a gynecologist. All has been changing the characteristics of physician. As per my personal experience, my close relative who is mostly going for a male obstetrician. He is going for male obstetrician. They are giving supporting their knowledge of awareness should be created to an individual level, and the awareness should be they can start from social media. In the social media also they are promoting that only the female physicians are present. They should be changed. For individual change, the whole community can be changed. Thank you. Ma'am, I hear you, ma'am. Ma'am, I can't. Ma'am, Ma'am, your voice is not audible to me.
Ma'am, not audible, ma'am. Ma'am, no, ma'am.
Bro,
You able to hear me?
Yes, ma'am, audible, ma'am.
Yeah, okay. Swamiram and Subhash. So you had mentioned that at the student level itself, girls are able to correlate better with the subject and they're able to understand what is going on. Do you feel that men have a difficulty at that level, in the student level, to understand certain things?
Yes. Mainly in constitutes the heart. So, not only by the female so this more interest. We feel starting to
Sorry, your line is disrupted. It's breaking in between.
Can you check your network?
I'm audible, ma'am.
Yes.
Yes, ma'am. That's my only point, ma'am. There is no major difference, ma'am. But slight variation is due to that anything that ask me it would be more precise. And that is the one. Same
Okay, okay, thank you. Next team. Who's the next team?
Good evening.
Team 17. Okay. Your good name? Can you on your video?
Yes. Good evening.
You're with your teammate?
Hey, I think it's not that.
Okay. What about team 15 and 16?
Hello.
Hello?
Good evening, ma'am. I'm from team
15.
Team 15, we are here, ma'am.
Okay.
And the is SRT.
Yeah. Please start.
Good evening, ma'am. Myself, Prasad, final year MBBS student from Stanley Medical College, and
Please
I'll
on
be
your
speaking.
video.
I have switched it on, ma'am, but am I visible, ma'am?
No.
I think there's some issue with my camera.
Okay, this is Prasad, right?
Yeah.
Okay, continue then.
I'm a final year student from Stanley Medical College. I'll be speaking about the gender disparity in obstetrics and gynecology. That is, there is gender disparity in OG. I'll initially start with UG, then PG, and I'll go into the professor. So I'll go in that order. First of all, myself being a final year student, while I was attending OG posting, we were asked by a professor to see pap smear and the other cases and all. At that time, one patient was not allowing me to stay there. She was asking me to get out so that she could be examined by the PG. So right from the UG level, patient are not feeling comfortable with us. Then coming to the postgraduate level, I couldn't find a male PG in obstetrics and gynecology that easily. Even if they take OG, they will be feeling alone because they won't have a companion. Everyone will be females, and if there are only one or two male PGs, it will be quite difficult for them. They'll be in a different hostel. They can't discuss with the PGs that easily, so they'll feel lonely. That is as far as PGs are concerned. Now coming to the professors, while taking class, I see professors saying that boys will escape OG easily. So girls should know that thoroughly. So they focus more on girls. I'm speaking about certain professors, not everyone. So those are the disparities in the professor level. Now coming to the labor ward and government setups. As far as government setup is concerned, not every hospital has a private ward. We have a common ward where all females are placed in different tables, and only screens will be put up in between. So in that case, husbands cannot be there inside. So that itself creates a gender disparity. So coming to other things like in case of surgery, if a male goes there, female PG can female PG or an assistant will
Prasad, can you come to your conclusion statement? Prasad, can you please conclude?
Okay. If there is a surgical case like hernia or circumcision, a male can examine, but we don't see. I mean, a female can examine surgical male cases, but a male doesn't. We cannot see them easily doing that because the patient don't feel comfortable. That is my point, ma'am.
Okay. Your partner? Yeah.
So good evening, Madam all present here. I'm Ritik Savla from Grand Medical College, Mumbai. So I'll be speaking about this part. In 4 phases. So first is medical students. For medical students, what I feel is if a person, a medical student takes interest and wants to learn something, there are definitely ways even professors are willing to teach them and make them understand things. There is always a way out. Second is the perspective of residency. Starting of residency, that is like selection of candidates for any field, maybe OBGYN or any other field. It is dependent on the marks you achieve in the entrance exam, or based on merit and not on gender. So that is the point. And for the third perspective is after residency, in various colleges, there are male OBGYNs who are at a high post, like even HODs and professors and associate professors and all. So with females. So yeah. And lastly is the perspective of the patients. What I feel is definitely there is a predisposition for females, but if the doctor has compassion, has empathy, has skills, has communication skills and clinical skills and experience, definitely people do prefer to go to them as well. So it is not ruling in, but ruling out. So Yeah, to conclude, I would say that gender disparity although present to some extent, but it is a relative concept. Thank you.
Okay.
Prasad, can
Prasad
you
and
please
Ritik.
mute?
Okay. Yeah. So, to both of you. So, for example, you're taking up gynecology later in your years. Do you think you will be able to give the same amount of effort and care as your female counterpart, or even outbeat them?
So, ma'am, for this, I would like to say that first of all, it's based on the interest of the person. If the person has interest in that, in the field which the person is taking, definitely he or she will put their best. And it's not about just competing with competing between males or females. It's about gaining the knowledge, gaining the skills, acquiring the skills. And if the person has interest and the person is willing to do, then definitely the person will, whether it's a male or a female, they will surely go for it.
Okay. Okay. Next team. Who's the next team? Team 16, are they there? Or they move to the team 17?
Yes, ma'am. I'm here. My voting is still in the waiting room.
Has she joined?
She says she's still in the waiting room. Her name is.
Good evening, ma'am.
Good evening.
Good evening,
Good evening. Who is talking?
Ma'am, we are from team 17. Just now I was letting.
Ma'am, we're
uh,
team 16, ma'am.
Ma'am, we are team 16. We were just
Okay,
letting.
team
Okay.
17, please wait. Team 16, Pragya and Nivedita, you
Yeah.
Okay.
I'll begin. Good evening, ma'am. I'm here to talk about. Good evening, ma'am. I'm here to talk about opposing gender disparity in the Ops Gynae department. So, in this regard, I have several important points to place. The most important one being that the perspective of the people gets limited when it is confined to a single gender. Let's say if there is equal representation of male and female, there are different perspectives that come in, and people are able to put forth different ideas, and there can be a healthy discussion. Moreover, OpsGynae is a department where you can have a lot of research opportunities, and the research opportunities being limited only to the females, and the males are not allowed to explore it, while they have the equal potential of reaching greater limits and leadership. All of this can be brought in by bringing about rules that are against gender disparity, and moreover it's about the patient comfort. So there is any issue with a female patient, there might be a male attender, and if there's going to be a female doctor or a female postgraduate who's going to explain it to the female patient, at times there might be issues in communicating it well to the female attender. In that cases, it would be really helpful in having a male doctor who would be able to convey it to the patient as well as to the attender and understand both their mindsets and perspectives. Okay. The final point that I would like to place here is about encouraging diversity. More the diversity that comes in, more the number of people who are going to be willing to come out of the stigma about any obsgynae related issues, the social stigma of speaking it out, and other such stuff. Thank you, ma'am.
Good morning, ma'am. I'm Nivedita, and I'm going to be talking about why we should be opposing addressing this gender disparity. So, like my friend said, there is a certain sense of familiar rapport that there needs to be between the patient and the doctor. And I feel with a female doctor, you get this better because as a woman, I know what it is like to go through a particularly bad period or to talk about a gynecological or obstetric problem, I would feel more comfortable talking to a woman rather than a man who has no idea what it is like. And with respect to the skill that comes, so since the PG entrances are totally controlled by how the marks are, this is a common scoring. So based on skill, we can't discriminate between male and female doctors because they're there because they have the skill and they're there because they chose the subject. If more men do not want to go towards the obsgynae department towards that field, then we have no right to force them to go that way. It is their choice to make. And I feel that there has been a rise, like, so there is now about 59% of the obscene field is made up of women. But 50 years ago, that percentage was 7% women. And this disparity has been addressed enough, and it's close to almost half now, right? So why do we want to upset a balance? And I agree that you need to have to look at both sides of the argument. You need to have different views, and that's what you have. You have 57% of females and then 43% of males, and that's as good as an equal balance that you're going to get. So yes, I would like to conclude with that. Thank you.
So Pragya and Nivedita. So you had mentioned that there were larger number of male gynecologists earlier, which has declined, and now the females have taken over. Where do you see the future? Do you see this pattern continuing, or do you see the older trend coming into play?
Ma'am, so now that there has been a lot of voices that have been raised over this trend, and people are camping, there are people to both sides of the argument. People are saying that we need a differing opinion and that we need it to be balanced. And then there are people saying that nobody raised this concern 50 years ago when there were only 70% of gynecologists. And only like it is in a woman's nature to be more caring and compassionate and to be able to understand another person's pain because you have gone through the same pain. You are able to empathize with them. So there is no fixed plan or legislature that's going to impose any sort of restrictions on the numbers that we currently have. But there are debates and points to both sides.
And Pragya had mentioned that there are a lot of research opportunities when it comes to gynecology. Do you see a lot of female scientists?
Being female or male is not very important in taking up the research, but more what matters is the interest. And there could be a lot of males who are there. They want to learn more about things, the curiosity and the inquisitiveness about what exactly and how exactly the system works might be in them, but they are not able to get into the proper research field because of the social stigmas and barriers. So I think that there are a lot of female scientists around who are researching in the obstetrics part of medicine, but I also feel that there might be an equal number of males who are interested in it and are not able to enter because of such a preset mindset of the people around them.
Okay, good.
Thank you, Yogita.
Thank you.
Team 17, are you ready? You can start now.
Yes. A French philosopher considered that man is the sole animal whose nudity offends him. Good evening, I'm Anna from GKMC, and I firmly believe that we shouldn't address gender disparity in obstetrics and gynecology. In a 2021 study, most female gynecological patients mentioned that they preferred female doctors because they would better understand them and build a better rapport with them. Considering that patient comfort is utmostly important in such a vulnerable doctor visit, I believe that it is where the gender disparity exists in obstetrics. Further, women have worked long and hard for decades to be accepted within this field. Today, there are more than 50% of all gynecologists are females. This is a hard-won figure, the current acceptance of women in a field that they are intrinsically linked to. Additionally, female gynecologists are more likely to be supportive of abortive needs, and they're more likely to refer their patients to a specialist. And perhaps the preference that women have today for female gynecologists is symptomatic of a fractured society. But educating all Indian women and families on a more liberal outlook, one that accepts the existence of male gynecologists, is a time-intensive process. Is it fair that during this time we deprive these women of security and comfort during a gynecological visit? Especially when much of female reproductive and sexual issues are still considered taboo in a lot of parts of India. I firmly believe this is not an issue of today's India. After all, in Marlon Brando's words, privacy is not something one is entitled to, it is an absolute prerequisite. I'd like to conclude on a short rhyme. I am emotions flowing, I am strength unswaying. I demand mind care and I demand soul care. I demand a doctor who understands me. I demand a doctor that knows me. My privacy is my own and my right to choose is my own. Thank you.
And your partner?
Good evening, ma'am. Am I audible?
Yeah. Can you switch on your video?
Yes, ma'am.
Please start.
Yes, ma'am. So, ma'am, I think this, yes, ma'am. So, good evening to respected jury. So, I'm from Government Kirpak Medical College, and I'm here to give my speech on that the House should address gender disparity or gender inequality shouldn't exist in the field of obstetrics and gynecology. So first of all, I am not here to put any one particular sex on the pedestal and to say that this particular sex would be better in the field of obstetrics and gynecology, and not to say that males are better performers or that. So first, and I'm not going to give much information on statistics as well, because it's well known that the percentage of the female gynecologists are more in the world. That's why this entire topic came about, that we should address this gender disparity. So first, it's actually told to the society that how would a man understand a woman's problem of menstruation, etc., because he has not undergone that. I'm here to ask a small question. We are geriatricians, doctors have been geriatricians, bariatricians, etc., where, and in case of bariatricians, it is the fat population. So that doesn't mean that a lean doctor or a fit doctor doesn't understand the feelings of a fat person or old age person. Just like that, it is a small population and you're meant to be neutral and address what is best for them and not your own personal judgments. But still the society will say, but it's sex. You can't, being a woman, you can't be exposing your sexual organs to the opposite sex. There's one more thing. Your body is your property and your sexual organs must be thought personally and by your own partner and not by anyone else, whether it's the same sex or the other sex. So I'm here to give a small poem of a male gynecologist. So if he's competent and skilled, of course, he can be consulted. So first, the very sight of birth gives me so much mirth. Those tiny little toes, the only ones without force. God created the divine child. Amazing, isn't it? Makes me wild. Sweet creatures speaking the language of love, sending messages via pigeon and dove. God created the divine woman. Oh, she's such a good woman. I want to erase all her pain. All my intentions are vain. I tried hard to make her heal. Oh.
Rima, sorry to interrupt. Can you please conclude?
Yes, ma'am, just a few lines. I tried hard to make her heal. Oh, he's a man is what she feels. I think I'm capable. But why is my gender so despicable? God, please give me a chance. Oh, my emotions are in a trance. Thank you.
Okay. Anna and Reema Shruti. So both of you have talked a lot about privacy and all those things. So as patients, you both as patients, at your vulnerable point or at your private point, would you allow or would you prefer a male gynecologist to examine you, or you would still ask for a female gynecologist?
Ma'am, if there is a female gynecologist who is quite near, obviously I would go to her if she is equally competent with the males. It's not male or female, it's just the doctor, who he or she is. And I personally don't have a problem of a male gynecologist examining me.
What about you, Anna?
I agree with Rima. I understand that this is not possible for a lot of women, but given the option between an equally qualified male and female gynecologists, I don't think I would be partial to the female gynecologist. If they are equally competent in this society, I feel I am safe enough and I have enough of a choice to choose the male gynecologist.
And I want to repeat the other question. So earlier there were more of male gynecologists. Now we see a rise of females. Where do you see the future? The old trend or the current trend continuing?
Honestly, I think the trend has come. Like at this point, we are very 50-50 on male and female gynecologists, and I think this is the way it will continue. And looking at the situation from both sides, it is a very reasonable stance. The difference of opinions and perspective is equals.
Okay. Good. Yeah.
Ma'am, may I speak?
Yeah.
Ma'am, I feel that there will actually be a mixed trend. So since now the awareness is more and there are more things going on in the media, social media, etc., I think people will be more informative. I think this mindset of the people will change, and both male and female gynecologists, provided they have the interest in that particular field, will come up. and there won't be any sort of disparity. I hope so. Thank you, ma'am.
All right. All right. Okay. Thank you. I think it comes to the end of the session.
All teams have participated.
Okay.
Audible, ma'am?
Sorry?
Am I audible?
Yeah, tell me.
It was an immense pleasure, ma'am, for hosting you. Really appreciate the time and effort, ma'am, making our evening a great success. Because we need to learn a lot.
Thank you so much.
Thank you for your participation in our upcoming.
Sure, yeah. Thank you so much. Thank you.
Thank you, ma'am.
Ma'am, if possible, you can announce the results, ma'am.
I think I need a little time. There is.
Okay.
Yeah. Okay. Everybody is there in here? I don't think so.
Thank you, ma'am. And one more thing, ma'am. Actually, was I audible?
Yes, you are audible, Reema.
Because in my place, actually, there was a little bit of network issues. So whether my words were clear.
Yeah, you were very clear.
Thank you so much, ma'am.
Thank you. Are there any screenshots or recording of the session?
Yes, ma'am.
Okay, please do forward them to me. Okay.
Sure, ma'am. We will send.
Ma'am, can we leave?
Yeah, I think so. We can end the session, right?
Yes, ma'am.
Thank you, ma'am.
Yeah, thank you so much. Thank you.
Thank you, ma'am.
Thank you for hosting me. Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you so much, ma'am.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
I think Tamilarathy and Praveen had helped me in the back end. Thank you so much, and thanks to my student Pratish.
Thank you, ma'am.
See you.
It was immense pleasure having you here, ma'am.